And thanks so much, everybody, for joining us today. We've got a full house, and I know people will continue joining. We have a stocked agenda, so we'll go ahead and get started. Today's call will be recorded so that we'll be able to share for those who aren't able to join us today. And without further ado, we'll go ahead and kick off. I'll hand this over to our Executive Director, John Clymer.
Well, welcome everyone, and thank you for joining us today. We're delighted that you are part of the Move with the Mayor initiative, and thank you for leading by example in creating healthier communities for your residents. This fall marked the 9th year of Move with the Mayor, and we're excited to see its continuous evolution and expansion. I want to express my gratitude right now to CDC's Division for Heart Disease and Stroke Prevention and the National Association of County and City Health Officials for their support of this initiative. They provided the fuel for the initiative. Their support makes it possible for the National Forum to support you and your community. During this meeting, we're here to recognize your achievements and hear from Mayors Ramiro Garza Jr. and Michelle Romero regarding their Move with the Mayor Fall Challenge programming and lessons learned, as well as view some spotlights from the many activities that you hosted in your community and look at collective accomplishments through the roadmap and how you can use the recommendation report that's coming out to continue to advance your efforts. We'll take a look at what's ahead for Move with the Mayor and allow time for questions. And we're going to do all that in 30 minutes. So right now, I'm pleased to pass the microphone to my colleague, Jen Childress, the Director of Programs at the National Forum. Jen?
Thanks so much, John. Next slide, please. So during today's conversation, we really want to acknowledge and celebrate, as John mentioned, the 9th year of Move with the Mayor, and without your participation, that wouldn't be possible. So during the Fall Challenge timeframe, September through October, 30 cities participated, hosting more than 60 events. So we're pleased and delighted to see the participation throughout the country. And in a little bit, we'll see the exciting events that you all hosted and the variety and learn and hear from one another. Next slide, please. I would also like to acknowledge our partnerships. We were able to provide additional resources and programming through our partners, Active People, Healthy Nation, Live to the Beat, and Spark America with their physical activity tracking platform. Next, please. And so now I'd love to get into our spotlights today from cities. Mayor Ramiro Garza Jr. from Edinburgh, Texas. We met this summer at the U.S. Conference of Mayors meeting and talked about Move with the Mayor, and Mayor Garza and his great team jumped in with both feet. So just wanted to have a chat and see, Mayor Garza, what inspired you to join Move with the Mayor and get so involved on your very first go-round?
Well, thank you for the opportunity. Really, we're always looking for ways to get our community engaged. But I will say, in our community, we have such an active community. We actually have an initiative called Active Edinburgh, and it's a website it's a link on our site that people can access for all our events that we have. We have so many different activities in our city. And I just felt this initiative would allow us to have a structured way, to get involved and to get the community involved. I have a Edinburgh 2040 Health and Wellness Committee, and they embrace this concept. And we thought it was a good way for us to bring people together and kind of share in on, our healthy way of living. So that's what really got us to, it's kind of taking what we're doing here locally to a national level. And that's what really was our interest. And we're happy to be a part of it.
That's so exciting. And you partnered so well and had an art walk and had over 200 people join your first event. So you really created a fun and inviting atmosphere. What are some of your top takeaways, or what would you encourage other mayors to think about when they're considering joining or diving deeper into the Move with the Mayor initiative?
Well, first of all, again, this is such a structured program. We really enjoyed being a part of it. And what I'll say is for other mayors to look at this, if you're looking to kickstart some kind of, health and wellness, in your community, if you don't have a structured, let's say, initiative, this is a good way to kind of kick things off. We all have different events in our communities, right? We have 5Ks, we have different events. But what I learned from this too is that it doesn't have to be that daunting. It doesn't have to mean you got to go out and run a marathon, right? It really just means that, simple, physical activity, just walking, will go a long way, and living a healthy lifestyle. And I think for us, it just helped to bring this concept into our city and make it a part of what we're doing. As a matter of fact, we had that walk with the mayor that first day, and we had, like you mentioned, about 200 people that joined us. And the very next weekend, it just had already been planned. We had another event for our 9/11 remembrance ceremony. We actually had a 5K event that was tied in with that. But everywhere we were at that month, we were asking people, make sure you sign up your activity. And so it was just a good way. And I encourage other mayors to really look at this as a way to, get your community engaged. And I learned that a lot in our community, a lot of people are very competitive and they like to update what they're doing. And this was a good way for us to do that.
Excellent. Yes, you made it simple, fun, and engaging. I think those are great keys to success. And this was your first experience as well with your team completing the roadmap. What did you learn from that experience, and what are some of your key takeaways?
Well, thank you. I learned that, again, it's about planning ahead. And we have different, again, activities that we have. And I learned that this is a good way to have a way to plan things out, right? To have different events so that it's not just about a 5K. It could just be about a stretching exercise. It could just be about just about anything. And I learned that you can make some of these things a part of what we do as a city. We got a lot of our employees involved, which was very, very good. And I think it went a long way. And I think for me, the biggest takeaway is that, this year, this structure here allowed our community to be engaged with us and, share what it is that they are doing to live a healthy lifestyle. And so we look forward to participating on it again. It really helped us, kind of complement everything else that we do.
That's wonderful. I think really speaking about friendly competition, you set the bar really high, and I think you have a lot of cities who are wanting to replicate and join the charge along with you. One of the things I wanted to bring up as well, I know on our onboarding call, you asked about, okay, we have the programming piece, but yet you were also interested in policy and learning more about like how you can impact your community from a more sustainable level with some policy implementation or learning about what other cities are doing. So are there any takeaways that you have yet or ideas planned in terms of enhancing what you're already doing from a policy perspective?
Sure. Well, we're evaluating that right now. I really would like to see, from a policy standpoint, we actually are, updating most of what we're doing from a development standpoint with trails. We actually are about to connect our community to our neighboring community to where somebody could just get on a trail south of us in our neighboring city of McAllen and either walk or jog all the way to university, which is in our city. And that's, I think, if anything, we'd like to look at ways how we can integrate healthy living, making more trails available also, but at the same time, using this as a method for us to encourage just people to just stay active. We live in our community. We have very high concentration of people with diabetes and other diseases that I think if you just stay active, it can help, with that. We also learned that information is key. I really liked the app that y'all had that had a lot of information on there as to what people could do if they have a question about something. We're hoping to integrate that into a link on our site in our Health and Wellness 2040 committee so that, very simply, people can get information on anything they'd like to know, anything health and wellness related, and also learn through this app how we can include some of those things in this resource site that I will call it.
Wonderful. Well, thanks so much for being an inspiration to your community and the nation, and for making the healthy choice the easy choice. So next, I'm going to kick it over to my colleague Jasmine Manglion for our next spotlight.
Hi, everyone. Next up, we have Mayor Michelle Romero of Henderson, Nevada. I love working with Henderson year after year. And as a new mayor, how has Henderson's program supported you in your role? And why is it important to you to continue the Move with the Mayor programming in your administration?
Well, our community just in general is a very active community. We have a huge emphasis on parks and trails. We have over 220 miles of trails in our city that connect us throughout the valley. We have over 73 parks. We have more coming this year. So our community likes to get out and get moving. And so it was important for me to make sure that we supported that. And so we've been doing Move with the Mayor activities throughout the year that feed into that active lifestyle. We've done all kinds of things, like having a month dedicated to swimming. We've had dance parties with our Battleborn Kids programs, which was our before and after school programs. We focus on everybody. We have things for kids. We have things for families. We have things for seniors. We had a day where they came out and I went ice skating with them, with families, and we had over 200 people show up to go ice skating. So it's just a constant thing that we do to try to make sure that we have opportunities for people to get out of their homes, to socialize, and to get moving.
Yes, I love how involved you are. We saw that picture of you shooting hoops with the kids.
Yes. I have a lot of grandkids, so I gotta keep up with the kids.
And you were in heels too, so can't forget that. Well, Henderson during the spring challenge had over 1,000 kids participate. How did the city of Henderson and your partners encourage kids to join the spring challenge, and then even use the Move with the Mayor fitness trackers?
So we have a lot of before and after school programs, and we coordinated with all of them and made it so that it was a fun activity for the kids. And so this year we made it our kind of big event, the rock and roll dance party. And so we had kids come out and meet the mayor, and we had a rock and roll dance party. We had blow up guitars, we had all kinds of things, and we just cycled the kids through, and everybody danced and listened to music and just had a really great time. So I think it's important for us, if we make it fun, the kids will come. And we had so many just smiling faces and happy kids, dancing around, expressing themselves, and it was just a great opportunity to get a lot of kids involved in something that was just fun.
Oh yeah, and they had a lot of fun. So the kids logged over 2 million fitness minutes, everyone.
Yes, they did.
What tips would you give to cities that would like to recreate the success of the Kids Challenge? Because that is great. Those results are amazing.
Well, like I said, we had it at numerous locations, and so kids like to be competitive, and so we do it not only with this but with reading also. So we get kids to want to compete against each other for how many minutes they can move each day, and they naturally rise to the challenge. And when you make it fun, so they don't even realize they're exercising, really, they just are out moving around, having fun. They're either playing or dancing or playing basketball or having some other type of activity. They don't realize it's exercise. They're just having fun, and they're competitive. And so each location is trying to outdo the other one for number of minutes moving. And it just works out that we were able to rack up a lot of outdoor minutes working. Like I said, our community is naturally active. And so a lot of times they're out anyway. And so when they know they can track their number of minutes and have it go toward, winning something, it helps them pay attention more to their time outside.
Oh, that's awesome. Oh, that's great, Mayor
Thank
Romero.
you.
Well, this was a very successful year for you. And so we look forward to seeing what else you guys all come up with.
Thank you.
Thank you for your time today. And now I will kick it over to my colleague, Michelle.
Thank you both so much for sharing your experiences. One commonly asked question is, what approaches have other cities taken? Here we've highlighted some notable strategies and events employed by cities new to Move with the Mayor, showcasing innovative ways that they've motivated their communities to engage in physical activity. Mayors nationwide consistently find creative initiatives to integrate physical activity and heart health into their programs. These initiatives also spotlight collaborations with local entities, such as businesses, nonprofits, civic groups, and other governmental organizations. Utilitarian physical activity refers to activities that serve a practical purpose beyond the immediate health or fitness benefits. Unlike traditional exercises focused solely on improving physical well-being, utilitarian physical activity involves incorporating physical movement into daily tasks or routines to achieve a practical goal. This could include activities such as walking or cycling for transportation, taking the stairs instead of the elevator, or engaging in active community. Mayors play a pivotal role in promoting utilitarian physical activity by incorporating it into community events and initiatives. By prioritizing utilitarian physical activity in community planning and events, mayors can contribute to the overall health and well-being of their residents while creating a more active and vibrant community. This year, we were pleased to maintain our partnership with Spark America, providing complimentary access to its activity tracking platform. This allows for the compilation of each city's physical activity data and the viewing of leaderboards nationwide. We appreciate their ongoing collaboration. Current Move with the Mayor cities participated under their existing city names, while new cities to the Spark America Fit City Challenge were included in a general Move with the Mayor category. Move with the Mayor had 4 cities finish in the top 10: Akron, Ohio, Hanover Park, Illinois, Edinburgh, Texas, and Rochester, Minnesota. These cities also qualified for codes to distribute for free bionic shoes. We also had several cities rounding out the top 20. Congratulations to all participants. And now we will hear from Emma Wall.
Thanks, Michelle. I'm going to walk us through the roadmap results and talk a little bit about the roadmap recommendation reports. So I just wanted to start by saying a big congratulations to all 20 cities that completed a roadmap this year. We know it can be a somewhat difficult or time-consuming task, but we do really hope that the self-assessment and the report that we'll get into a little bit later will give you ideas for policies, programs, and activities to promote physical activity in your communities. This year, we had 3 cities that achieved gold, 6 that achieved silver, 5 that achieved bronze, and 2 that reached striving. We wanted to give a special congratulations to both Camden and Tacoma, who both increased their level from last year. So overall, cities achieved an average of 53% of the total possible points across all categories. So just to orient you to this graph that you're seeing here a little bit, you can see that total score down along the bottom with 2023 results in the darker shade of red, or the section totals in the darker shade of blue, and 2022 in the lighter shade. The roadmap includes 11 core sections. Most notably, up at the top, you can see the public health section received the highest possible score this year. You can also see with that jump from that lighter shade from 2022 that this section had a really notable growth and increase this year, which we were all really excited to see. Rounding out the top three, you have both the Parks and Recreation section and the Nutrition section, also where participants received right around 82% of the total possible points. This sections related to partnership and city policy both did see a little bit of a bump from last year, but both remain areas of opportunity. So in addition to using the roadmap as a self-assessment, the National Forum team uses it to look at what evidence-based policies, programs, and services cities are implementing using a tool called the Community Guide. The Community Guide is a compilation of evidence-based programs, policies, and services that improve the health of population. So this tool is compiled by an independent panel of experts that are convened by the CDC. And it's their job to take a systematic look at all of the research evidence that all of the academics put together and to come up with recommendations to determine what community-based health promotion and disease prevention approaches work and which do not work. So utilizing the roadmap responses, we're able to put together a rough gauge looking at which of these community guide recommendations Move with the Mayor cities were implementing. With the information that was included in the roadmap, we were able to look at the 15 community guide recommendations that you see listed on the slide here. These activities range from things as simple as including signs to encourage stair use, worksite wellness programs, and things as complex as park, trail, and greenway infrastructure enhancements. Looking across the board, we found that all cities that completed a roadmap were implementing at least one evidence-based practice. These interventions that cities are implementing have evidence behind them showing that those programs increase walking among priority populations and improve overall physical activity. Cities were implementing an average of 9 community guide recommendations shown here in this chart in red. Looking at which of those interventions cities were implementing, we found that nearly all cities were implementing social support interventions to promote physical activity, such as hosting Move with the Mayor physical activity events, as well as supporting healthier snack, food, and beverage choices in schools. Now to transition a little bit to those roadmap recommendation reports. Prior to this call or very shortly after, everyone who completed a roadmap should be receiving a tailored roadmap recommendation report that looks a little like something that you're seeing on the screen here. These reports feature a recap of your roadmap responses along with recommendations, resources, and examples related to each section to help guide you in 2024 and beyond. In addition to the recommendation reports in that same email, we also provided cities with a press release to spotlight your participation in the challenge and your accomplishments. We would encourage you to use this to highlight all the hard work that you, your staff, your community members, everyone has put in throughout the Move with the Mayor challenge. So diving a little further into the roadmap recommendation report, for each of the 12 sections, there'll be 2 tables similar to what you see here on the right side of the screen. Up top in the blue table will be a summary of your responses and your scores. Then in the red table, you'll find the recommendations. These will be tailored based on your specific responses and how you completed the roadmap. The recommendations will feature examples of what other Move with the Mayor cities are doing, as well as other resources the National Forum and partners have identified to help you implement the policies, programs, and activities related to each of the roadmap sections. Additionally, some of the roadmap recommendations will feature more information about those community guide recommendations that we mentioned, and some examples and ideas and resources for how to implement those evidence-based practices. And I will turn it over to Jen.
Thanks, Emma. So looking ahead, although the official challenge period may be over, we want to emphasize that our team is here to cheer you on, encourage you, help amplify, and provide additional resources and technical assistance on policy programming and partnerships throughout the entire year. So please don't hesitate to reach out to your community engagement coordinator. And we would like to announce that For the spring challenge, we are teaming up with Mental Health Month and hosting the challenge throughout the month of May to foster social connectivity along with physical activity and promote the benefits for physical health as well as mental health. In addition, we continue to focus on utilitarian physical activity, meaning active transportation, active jobs. So if you're hosting any events that you are focused on, perhaps stretching before the workday or encouraging your city employees to be active throughout their work time, please let us know. We'd love to spotlight you. Through everything that Move with the Mayor does, we focus on health equity, and we will be sending out a survey after this call, which encompasses questions around health equity and what you're doing. So we'd love to be able to focus and do some case studies and spotlights on all the great activities that you have within your programming. Speaking of the survey, we'd love to continue to be able to provide Move with the Mayor services and support that you find useful. We want to continually improve, and we are open to hearing your feedback. So in the chat function right now, you can see the link to the short survey. It'll take approximately 10 minutes to complete, and we take your feedback to heart. Every year that the program evolves, it's due to your feedback. So it's important to us, and we want to hear your thoughts. And so with that, I will turn it back over to John, and we'll open the floor for question and answers to close us out.
Well, thanks, Jen. And thank you very much to Mayors Garza and Romero for talking with us this morning or this afternoon, wherever you are. We really appreciate your comments, your insights, and congratulate you on your successes. I want to not only recognize Mayor Mitch Roth from Hawaii for joining us at an uncivilized hour of the morning. Aloha, Mayor Roth. Want to thank you as well for your participation, and want to ask you if you can just say in a minute or so how you use Move with the Mayor to help the people of Hilo and other communities in your county become healthier.
Yes, aloha. It's actually not too uncivilized. Started at 7 this morning over here. So yeah, we've been using Move the Mayor on both sides of the island, Hilo and in Kona. We have the whole island. We've been running it with different events. We did one this last weekend with a health event in Kona, where they were talking about healthy eating and things like that. And so we got a group of people. What I like to do with it is give people a chance just to talk to me about any kind of topic as we walk around. Oftentimes it's about health, but oftentimes it can be anything else. And the other thing is, for me, I had a heart attack a couple of years ago, and so it gives me a chance to talk about keeping people safe and healthy.
And thank you for sharing that. Gosh, there's nothing like sharing your personal experience, as you know, and all the mayors know, to help connect with people in the community and help get them engaged. So thank you for translating your personal experience to something that's going to lead to the betterment of health for everyone in the community. And thanks for spreading it around the Big Island. Mayor Bagwell, when I took a sip from my Starbucks mug or cup a couple of minutes ago, I was thinking of you and that great success story that you have about vaccinations. Do you have any similar stories of success about encouraging physical activity in Carson City?
You know, we just really had a great cleanup project at our cemetery. It brought out everyone. It let everyone feel they were doing something civic, and at the same time really doing something for those that have passed, that doesn't have any family anymore, to be able to help clean up their graves. And just do it as the Rotary Club and the Kiwanis. I think I heard Michelle earlier say everyone loves a little contest. Well, there's no doubt about that, right? They came and said, "Oh,
Exactly.
the Kiwanis did 72 grave sites," and the Rotarians were like, "Oh, well, we got you by 73." So. But it's really a great community event, and as someone said, they don't even realize they're exercising, right? Because they're just
Exactly.
doing something they care greatly about. So I really loved the cemetery cleanup.
Yeah, that's very exciting, and that civic engagement is one of the essential factors for health and well-being. It's proven to help people have better mental health as well as physical health. And I'm so glad you mentioned that, because it is a great way to reinforce what Jen announced about our including mental health in Move with the Mayor in 2024. We're very excited about that, because we've been hearing from all of you mayors how important mental health is to you and to your communities. And we know, because the evidence, scientific evidence is strong, that this will be a proven way that you can immediately act. You don't have to wait for Congress. You don't have to wait for your state government. You can take the lead on this and help people in your community improve their health, reduce the risk of or the degree of depression and anxiety and stress. So it's going to be a win-win. Well,
we even had someone donate a whole bunch of hose because they thought the ones we were using for the cleanup weren't good. So they can come back next year. It was fun.
That is great. Well, we thank all of you, mayors, mayoral staff, community leaders, for joining us today. We are at the bottom of the hour. We want to respect your time and let you move on to the next thing on your busy agenda. Thank you so much for joining us today. And most importantly, thank you for being part of Move with the Mayor and using it in your community to lead by example and to help everyone in your community be healthier and enjoy greater well-being. For now, thank you from the National Forum for Heart Disease and Stroke Prevention.